All right, well, let's get started. Hello, everyone. I'm David Shapiro. I'm the program manager of HealthLinks. We're a program at the Center for Health, Work, and Environment at the Colorado School of Public Health. And we've had the honor of hosting 11 now previous town hall meetings. This is our 12th meeting of this town hall series. And we've been really overwhelmed by the response from our participants, you joining us today, and everyone that's joined us over the last 3 months. We've had a lot of thoughtful and encouraging dialogue and questions and comments that all of you have shared. So we want to thank you for participating in the past. If this is your first town hall meeting, thank you for joining us today. As I mentioned, this is our 12th town hall webcast in our series dedicated to providing all of you with trustworthy information during these challenging times, supporting employee mental, emotional, and social health in the next phase of COVID-19. The pandemic has really impacted all of us and all of our work. Today, we're sharing information from WorkLife Partnership, a nonprofit organization focused on the unique challenges faced by lower wage workers and the experience of employees in the workplace and as we return to work. And as we enter this next phase, in our response to COVID-19, having a plan for supporting employee well-being is really now more important than ever. HealthLinks hosts town hall meetings to provide all of you with tips and resources to support yourself and your team. We're committed to the health, safety, and well-being of workers and of the workplace. And while we are still facing the challenges of COVID-19 all together, we do realize that each one of us and each one of our organizations faces unique and different obstacles. We know we're stronger when we focus on public health and when we support one another. We do want to inform you that we'll be taking a pause on our COVID Town Hall webcast after today's, our 12th meeting. We will continue to bring you up-to-date information through our research-based webinars in July and throughout the fall and summer moving forward. So today marks sort of a hallmark moment of 12 town hall webinars, this being the 12th one. And after this, we're going to take a brief pause on the town hall series and return to our webinars, our generally total worker health webinars. A little bit more about us as an organization. HealthLinks is a mentoring program that champions health and safety at work. Our mission is to advance worker health, safety, and well-being, and we offer evidence-based healthy workplace certification and advising to help organizations and their teams achieve total worker health. As a core outreach program of the Center for Health, Work, and Environment at the Colorado School of Public Health, our experience as researchers informs everything we do. Our center is one of 6 centers of excellence for total worker health in the United States, funded by the National Institute for Occupational Safety and Health, or NIOSH. A few housekeeping items to mention here. All of our participants will be on mute throughout the duration of our presentation. If you're having any technical issues now or throughout the presentation, use the chat function on your Zoom toolbar. And if you have any questions, we want you to start thinking about questions for our presenters or for HealthLinks. Use the Q&A box, which is down on your Zoom toolbar as well. That's on your control panel of the screen. Our webinar today is being recorded, and we will share both the recording of the webinar as well as the slide deck from our presenters in our follow-up email to you. There will be a brief survey at the end of this webinar, and we ask that you just take a moment or two to complete that. Our overview for today, we're going to have our presentation with some key learning objectives, followed by that live town hall discussion or question and answer session. So please be thinking about your questions as our presenters go through and start putting them in the Q&A box whenever you feel comfortable. I'd like to introduce our guest presenters today. We're really grateful and thankful for the partnership with WorkLife Partnership. So we have Brittany Robinson, Program Manager at WorkLife Partnership. Brittany's passionate about relationship growth and recognizes how life barriers can rob us of the confidence and stability we derive from our work. Brittany brings a deep skill set in assessment, treatment planning, and motivational interviewing after serving as WorkLife Partnership Resource Navigator for 5 years, and stemming from her work with individuals in substance abuse treatment. Brittany has worked extensively both in school systems and with individuals in crisis, She holds a Bachelor's of Social Work from Illinois State University and a Master's of Social Work from Colorado State University. She's a longtime volunteer for community youth mentor programs. So thank you, Brittany, for joining us today. We also have from WorkLife Partnership, Katie Lynn Vekere, the Employee Membership Director at WorkLife Partnership. Katie's been honored to fill the role of Customer Success Manager and Employee Membership Director at WorkLife Partnership for the last 2 years. Her role originated from the need to ensure that WorkLife's employer partners felt their voices were valued and to provide them with a liaison separate from their resource navigators. As account manager, Katie enjoys supporting employers in recognizing and acting on the importance of investing in their team members through a human-centered or whole-person approach. Prior to joining WorkLife, Katie worked with a variety of industry sectors and in partnership with community organizations in support of workforce initiatives. Katie has experience as a special education vocational coach for a local school district, in addition to serving as a Workforce Innovation Opportunity Act and AARP case manager for Arapahoe County. Katie has a bachelor's degree in sociology and religious studies from the University of Denver. I'm just going to take a moment here to pause and start sharing the presentation from WorkLife Partnership. Again, thank you, Brittany and Katie, for joining us today. Great, so I think I have your presentation open, and Katie and Brittany, please get started as soon as you feel ready.
Thank you, David. Thanks everyone for joining us here today. So we're going to be talking about how we're supporting employee mental health, emotional health, and social health in the next phases of COVID. And I want to talk a little bit about our objectives before we get started. So one, we're going to be talking about a clear understanding of how your employees have been impacted mentally, emotionally, and socially. How to identify the warning signs of that employee who might be experiencing trauma, and some tips on how to interact with that person, and how you can ensure employees are feeling supported. So we're going to walk through a bunch of different examples of things that employers can do. So to get started, we're going to ask a poll question. And so that question is, what's the biggest challenge you think your employees are facing right now? And you can see the answers right there on the screen. So go ahead and take some time. We're going to facilitate that. Select what you think is really going on with your folks.
Hi, Brittany. We've got a lot of responses coming in fast here, so we'll just give it another minute and then I'll show the results.
Okay, great.
All right, looks like it's starting to slow down. Go ahead and share those.
Okay, it looks like the majority of you went with the mental health concerns, 74% of folks. That's a good answer because, as you know, we're here to talk about the mental emotional health of our employees through COVID. Okay, so let's talk about the answer to that question. First, so you have a little background about us. WorkLife Partnership partners with employers to provide one-on-one customized support to employees facing barriers in life that impact their stability. We help connect to resources and find solutions. Our navigators are equipped with training in trauma, local resources, and person-centered approaches such as motivational interviewing. And so on my first slide, I want to talk about returning to work with increased distractions. Since the US began to quarantine, WorkLife has seen an increase in financial assistance need from our clients, over 900% higher than this time last year, to needs such as rent, bus tickets, car fuel, food, childcare bills. We've also seen the utilization of employees meeting with our health insurance navigators up, and there has been a 240% increase in mental health related referrals since COVID, and that's compared to the 3 months prior. So as you can see, all of those answers were actually correct. Basic needs have not gone away, nor has the struggle to maintain them. It's only been heightened. What's unique is when you look at how our social lives have changed and the impact on our relationships and the detriment that that has to our work, stress, and mental health, and the cycle that follows. So I'm so glad that you've all joined us because we want to talk about ways we can break the cycle for our business's greatest asset, our people. So let's start with what's going on with your employees. So on slide 2, we're going to visit how social distancing has really come at a cost. In 1943, Maslow's theory of human motivation outlines a set of basic human needs. They're organized into a hierarchy of 5, anchored by psychological needs at the top and self-actualization at the bottom. But the third level is a deep hunger for love and belonging, which is gained by connecting physically and emotionally with other people. Fourth is esteem, being we have a need to perceive ourselves with high evaluation and to feel respect for ourselves and others. So social distancing has changed the way in which we maintain and grow these relationships and our social capital. So in this case, that being the resources our relationships connect us to, tangible and intangible. For those who already lack resources, this can be a huge blow to their stability. Your parent who might typically be able to help with bills when you're short lost their job and they're struggling too. That friend that watches your kiddo has become ill, leaving you with no childcare. The nonprofit that you usually get food from is overwhelmed and wasn't able to help this week. Technology isn't your strong suit and you miss the faces of your grandkids, and it is heartbreaking. Social distancing orders have rapidly cut us off from physical connection with our social network. Physical connection being the primary way we cultivate these networks and relationships that are linked directly to our physical and mental health. So now luckily we have lots of technology, right, that facilitate this connection. We're using one right now, Zoom meetings, great stuff. And it works to an extent. What we lack are social norms around how we use these tools, what tools you use, how to connect, with who, when, how long, etc. You've all done it, by now at least, a virtual or phone connection with a loved one. It's different. It lacks closeness, sometimes presence, pieces of how we communicate non-verbally. It's harder. Non-verbal communication is 55% around there of how we understand each other. We also struggle with false beliefs when using this kind of technology. People are busy, they're overwhelmed, I don't want to burden them. They don't want or need to connect like I do. What if they don't want to talk to me? I don't want to make my friends feel obligated to support me. My need isn't as great as others. And sometimes, truly, it really is just easier to sit on the couch and hope that this all blows over and connect with people once we get back to normal. So this makes Maslow's concept of the need for esteem pretty hard, right? Now, for those who have been working or recently returned, consider how what used to be normal connection can now incite fear. A handshake, a hug, or a gentle touch to signal empathy. And wearing masks makes it harder to read emotions of others, not to mention it's uncomfortable, and sometimes we're wearing these things all day long. It's all still very surreal and stressful. Now, I wouldn't be a successful social worker if I didn't say this, so let me pause here. Your grief is worthy, even if it's grieving the summer you wish you could have. Others need to connect as much as you do. There is a line to obligation, but it's okay to be honest, and you do have things to offer others, and good things will come from finding a new normal. I just wanted to say that. So on the next slide, we can look into how taxing this experience can be to our mental health. So we get it, right? These times are unprecedented. It can cause stress, but our bodies are made to handle stress, right? That's true, but that doesn't mean our bodies are equipped to handle prolonged stress very well. When you're presented with a short-term threat, boom, your adrenaline, your cortisol spike. Negative effects of these spikes include increased heart rate, immune system functions are altered, your digestive system is suppressed. Essentially, your body is limiting what is considered non-essential in a fight or flight mode. So a prolonged exposure to these responses puts you at risk of things like anxiety, depression, loss of sleep, memory and concentration impairment, heart disease, digestive issues, and the list goes on and on. So perhaps you can see how this exposure can trigger a cycle. You experience the stress, you start to lose sleep, you are losing focus at work, you're making mistakes, that triggers more stress, your immune system is suppressed, you get sick, you miss work, loss of income, it goes on and on. Something else we do when we stress is we tunnel. So this concept is out of two psychologists who wrote about it in their book, Scarcity, Why Having Too Little Means So Much. I highly recommend that book. Tunneling is one of the concepts that stress can disable us from seeing consequences further out. It's like when something is missing in your life and you can only focus on that one thing. What you do in the short time might alleviate that missing thing, but long term there may and often are consequences. Not having that one thing is called scarcity. You have likely experienced this to some extent. For example, let's say you're running late to an appointment, so you lack time. You forget things, you make wrong turns, or at least I do, poor driving decisions. And so imagine that scarcity you could experience when you were poor, when you were sick, and when you're cut off from your normal relationships and resources. It really begins to compromise your mind in a very biological level. So this causes us to juggle other resources, and that is exhausting. And this exhaustion is tied to our economic success. Loss of connection and resources, stress, tunneling at this point, we are so tapped. And so these are some examples of what we've heard over the last few months. My insurance doesn't cover virtual appointments for counseling. Now I have to start all over and explain my life to someone, and I'm just so tired. I worry all the time, and I think, what if I was the one that got that resident sick? I'm the reason they passed away. My mom is sick. All I want to do is be close to her, but I can't, and she's all alone. I'm afraid my employer won't take protective action seriously, won't take my fears seriously, and I don't know how to communicate that fear without seeming weak or the odd one out. I think I'm grieving, but I'm not sure if my grief is worthy. On top of all this sudden change, we hear that infection rates are going up. Another 100,000 people could die, and the vaccine is still a ways off, 2021 at best. Where it's become, what happens if I lose my job again? What if I really can be evicted this time? At this point, I don't know who to believe. Is COVID as serious as some say? Keeping up with changes is depressing. Will my kids go back to school? If not, then what am I going to do? So if you are worried you are out of touch with your people, you probably aren't as much as you may think. So now that we know a little more of the science behind stress and where we all might be coming from, I'm going to let my colleague Katie take it from here to talk about what we can do about it.
Wonderful. Thank you so much, Britt. I really appreciate it. Just to give you a little bit of background and introduction, I'm honored to be able to join you here today. As Brittany explained at the beginning of the presentation, Brittany works very closely with our navigators who provide that direct one-on-one support to the employees with the employers that we partner with. Whereas within my role, I serve as that primary point of contact for our employer partners to ensure that they are getting their needs fulfilled and that they feel like they have someone that they can come to be accessing the resources as a business, to be supporting their workforce and investing in them in the best ways possible to ensure that they're really addressing and approaching these issues with employee whole person wellness and that longevity to make sure that those business outcomes are also put at the forefront of what they're considering in the moment right now as we continue to respond to the ongoing changes of the COVID crisis. So making a bit of a segue now, we have another poll question that we're going to ask. So on a scale of 1 to 5, I would love to know how well you all believe that you are supporting your employees right now. And you can see on the screen, you can see on the prompt that 1 is not at all supportive and 5 is extremely supportive. So support can take a route in many different ways, but would love just some initial feedback before we dive in a bit further to see what employers can be doing to support their team members during this time. So we'll give a few minutes and then, or few seconds, I should say, and then see what the results are on the screen. And thank you all for contributing. Very much appreciate it. Have to add in some interactive piece in these webinars, right? I know those are always my favorite parts, because then I'm reminded I have to pay attention at some point.
I'll say too, this is another really good area for when you start to think about putting Q&As in the box, things that your workplace is doing that is supportive or that you want to find more information about how to be more supportive. Start to think about some questions here to pose to our panelists at the end of the presentation.
Great, thank you, David. Great, okay, so taking a look at these poll results, I'm very encouraged to see that the majority of our percentages are from a 3 or higher, which is great. I know a lot of our employers are actively working and seeking opportunities to support their team members to the best of their ability during this time. And we recognize and we know that those opportunities are often tough to implement at times. There are concerns around what it may cost an employer, especially as they're going through just business hardships as themselves right now. And so it's great to see that there is that sentiment in their belief that there is that support and there is that motivator to really ensure that the workers are feeling that their needs are being met during this time. So that's great to see. Hopefully in the next couple of slides, you'll get a little bit more understanding about what we at WorkLife have been seeing with our employers, the feedback that we have been getting from them day in and day out about what those challenges are in making sure that their employees are feeling well equipped and well supported as they continue to contribute to those business outcomes, continue to return back to work, and continue to adjust to what we are calling this new normal as well. So one of the biggest things, I think if there's one takeaway that we want to stress at WorkLife in working so closely with our employer partners and members is that employees during this time just want to be approached with empathy and care. I think as you can see, first and foremost, we believe that the greatest success that employers see is placing an emphasis on that whole person wellness. So we really stress that that is that recognition and that acceptance that when someone is experiencing that trauma, that stress, that anxiety related to this pandemic for whatever situation they may be in, they're more likely to be exhibiting those signs of distraction or that signs of preoccupation or that inability to juggle as many different barriers as maybe they normally would be able to because they're already at that heightened level of stress and anxiety that, as Brittany mentioned, just inhibits your ability to really think through what some of those next steps may be, or even think through the option of, hey, am I able to talk to my employer about what's going on right now because I know that they care and they may be able to help point me in the right direction or at least grant me some of that grace. We've also seen, and I think employers have mentioned as well, that a lot of times employees may not even be aware that they're exhibiting some of these signs or showing some of these signs of distraction, preoccupation. There are so many other things going on in their personal life right now that they're trying to manage that those signs, those symptoms can actively come out in the workplace. And so it really does become a role for the employer to be able to not only identify what those are, but be able to approach those individuals in a very empathetic manner, compassionate manner, to be able to have those conversations and make sure that they're getting their employees back on the right track and sharing with them that they genuinely care and are invested in their well-being in the long term. So that segues directly into number 2 when we say that one of the most important ways to approach employees with empathy and care is going into conversations using that non-judgmental stance and observational statements. It's very easy, especially in the heightened state that we're all operating in right now, to go into that conversation with an employee that you're concerned about with some judgments right off the bat. What's wrong? You're acting differently. Or why are you acting in XYZ manner? Or, you were late. What's going on with that? We all care, but sometimes the words that we use and the tone that we use don't always give off that feeling that we know we so deeply have. And so we want to be very mindful of how we're approaching those conversations, which is why we recommend, and our navigators and doing role plays with managers, supervisors, even HR folks, will stress it's going in with those observational statements. So I have observed, I've noticed, I've seen, or starting the very sentence with, I care about you, and these are some things that I have seen. you don't have to share your personal information with me. I just want you to know I genuinely care about you. And I've noticed that this has impacted you at work. What are some steps that we can take? Going in that manner will help employees sense that you genuinely care. They know that, and there's more of that likelihood that they're willing to be open, they're willing to be vulnerable, and they're willing to help you identify what some of those remedies may be. And I know, speaking for myself, having used this over the years with coworkers, colleagues as well, it also sets you up to be more patient and understanding, knowing that you don't have the full story right off the bat. Someone may be exhibiting one sign, and there are a million other things going on in their life that once you start to unpack some of those, you go, wow, that's humbling. I would be reacting the same way you are, and I want to help you to be able to make sure we get you through this. So the next and the final piece that we have really identified is recognizing that challenges are not always going to be resolved when employees return to work. I think we've heard just in other webinars that we've taken part in, and even from employers, that there can be that misunderstanding that, okay, I had to furlough some employees, or some employees were laid off and now we can bring them back on. But a lot of these issues that they were having with their finances should be resolved now because they're earning their paycheck. They're back to their normal shift. And it's understanding that the challenges that were associated with the shutdowns and with this crisis really exploding back in March are not necessarily going to be resolved as we get back to work and we try to get back into that new normal. That trauma, that stress, that anxiety returns. And just because someone is receiving a paycheck again, just because they're getting back to that work environment, doesn't mean that their childcare issues over the summer aren't resolved, doesn't mean that they haven't fallen into financial straits because they missed many paychecks during those months leading up to now or current, that their spouses weren't hit by something health related and now they're hit with medical bills. So again, it's understanding that we are all in this pandemic and experiencing it differently. We're in it for the long haul, but that means that we learn to continually adapt to one another, and we grant everyone with the grace that we know that there's more going on and that we'll meet them where they're at in addressing some of those concerns. So on the next slide, we wanted to give you an idea because we've talked a lot about these are the things that people are experiencing. It feels hopeless and overwhelming, as I'm sure you all feel as coworker colleagues, as an employer, to really understand where you can start to get into that space of supporting your employees even more with some tangible steps and with some ideas that may not necessarily be the most cost inhibitive, especially as we know that businesses have been hit just with their own revenues coming in, forecasts. So today we wanted to give you a bit of an idea based on the feedback that we've been getting from our own employer members about things that they have done, steps that they put into place that are tangible, that are easy to implement, so that hopefully you can walk away with not only maybe just kind of a reminder or a reiteration of things that you and your organization are already doing, which would be wonderful, but maybe some ideas for some other things moving forward that you may be able to implement into your current programs, into your current just way of life in approaching that employee wellness. So one of the first and foremost, I talked about it, so I won't hit too much more on it from the previous slide, is practicing that proactive empathy. So going into those conversations, going into each workday, knowing that everyone has been impacted by COVID in some capacity, and approaching others and their situations with that compassion and that willingness to engage them in conversation and understand what some of those struggles may be, but also knowing that many of us are very private, and knowing how to have those conversations if you're seeing someone who could be in need, in referring them to seeking mental behavioral health resources, or in the means of our employers connecting them with a navigator to make sure that they feel they have that safe space to be able to truly unload and let go of what's going on, so that they can be in a better mind space to be taking those next steps for that emotional, psychological, physical well-being. The next one that we've seen, number 2, many of our employers are starting to tap into different community partnerships and applying for community grants so they can implement programs such as increasing their employees' hourly wage by $2 every hour for healthcare workers who are working in Obviously, situations where that stress and anxiety are heightened because they're concerned for their own wellness. They're concerned that there may not be all the safety measures in place, or they may be exposed. So trying to really help those employees with that financial piece right now by working with community partners to help offset the cost of increasing their employees' hourly wage, because we know that's something as a business that can be tough to do. So seeing where some of that other funding can be sourced in the interim. Many of our employers have created internal peer support groups. So whether that is leveraging individuals who really have that desire and that drive to be supporting their fellow coworkers, colleagues during that time, whether it's working with managers and supervisors to designate 1 to 2 of those managers and supervisors who employees can go to for anything COVID specific. Maybe it's related to their work itself. Maybe it's related to something outside of work and they just need someone to hear them out for 10 minutes because they're on shift and their mind is elsewhere and they need someone to help them clear their heads. Those peer support groups have also produced, we're thinking of you cards. How can we help you better during this time? Care packages. So really providing just that very gentle touch point that, hey, people are thinking about you right now and we care and we want you to know that we're here for you. Some of our healthcare employers and also some of our advanced manufacturers have dedicated a space for self-care. So whether that is providing free snacks, whether that's providing free drinks, some of our healthcare providers have provided, phones that people can call in to get mental behavioral health support for stress or anxiety, massage chairs, just a place that individuals can go. A lot of our employers have also put together resources where employees can go and just have tables of different resources available to them on childcare, on food and nutrition, transportation. So just a great go-to space dedicated to the employee and dedicated to them knowing that they, again, are taken care of and have a place that they can go just to have a bit of that reprieve during their workday. The fifth component that we've seen hasn't been implemented as much, but it is a very creative way to help support employees who may be furloughed or may be in a position where they're furloughed or layoff because their positions are considered non-essential or because where they're working, such as potentially a bank, if it's a branch bank, has closed down. We've seen employers be very creative in transitioning their bank tellers to their call center team because the call center team is obviously getting a lot more volume during this time when people can't be going in and interacting with tellers in physical spaces. We've seen other employers who have identified some of their other employee skill sets to help bring them on to different departments or roles in the interim so that they're not losing those shifts and they're not losing those hours, and therefore they're not concerned about that financial piece at the end of the day. On the next slide, you'll see 5 more ideas of some things that we've seen. So hopefully giving you just some great opportunity to think through what may be most easily implemented in your own workplace. Many of our employers have been working very hard and very diligently with their brokers, with their insurance providers to see what the options are to continue to help cover their employees' benefits, even if they are furloughed, to ensure that that is not one of the major concerns that are coming up. We know that that's one of the tougher things to implement, just given how health insurance works. But for the employers that we have partnered with who have been able to offer that, it gives the employees just that sense of stability and that peace of mind, knowing that if they do indeed get sick, if a family member gets sick, that they're not having to focus their efforts on worrying about what that financial bill is going to cost, that they can just focus on caring for that family member and themselves in getting better as soon as possible. The next one is somewhat similar to partnering with community members for grants, but some employers have set up emergency financial relief funds internally, whether that is a grant or a loan. So if employees are coming to them and saying, I'm going to be behind on rent, I'm not able to afford my vehicle repair because things have been so tight, given decreased pay, given just the fact that I'm having to spend more money, maybe it's childcare in a different place, whatever that financial situation may be, many employers have worked with us to set up their own internal programs to be giving their employees that option to come to them to get that financial support. And on the flip side, it also makes the employee feel very invested in that their employer is willing to help them with some of those personal financial concerns in promoting, again, that long-term stability by addressing that immediate concern. Partnering with local vendors, it's been really, really fun to see which of our employers are able to partner with food trucks, with local restaurants, to offer their employees free meals, to offer childcare resources, working with them to, even some of our advanced manufacturing companies have shifted some of their work to building protective equipment for healthcare workers. So just seeing those community partnerships build, seeing how people are being creative to make sure that, if there are donations in the community available, if there are any sources of partnership that are of low cost or no cost that they can be bringing in to just, again, make sure that their employees feel supported. Coordinating Staff Appreciation Weeks, Spirit Weeks, is a very easy way to show that care, having an emphasis on self-care themes, having a daily email, having just some fun and levity and humor brought into the workplace is a great place to start in really helping us to heal both currently and ongoing with this current COVID situation. So I'd love to offer it up for what other thoughts are, but I think that may be a good opportunity once we get to more of the Q&A. I want to be mindful of our time. So because of that, Brittany and I want to offer you a mock conversation of how it would look when an employer, maybe someone from the employer, manager, supervisor, an HR team member approaches an employee to have that tough conversation when they notice some of those signs, because we know that that's oftentimes one of the hardest things to do. And so we want to leave you with an actual example, and please forgive us that we're two faces in two different rooms on a different screen, but we hopefully will give you just some key talking points that we can hopefully spark some conversations moving out of this.
Hi, Katie. Do you have a few minutes to visit with me in my office?
I think so. Is it okay if I come back to the task I was working on?
Of course. Let's take a break. I just wanted to talk about how I might support you better as a leader. Katie, I've noticed you showing up to work late most days, and this past week I've observed you using your phone more than what is acceptable. I care about your well-being and you feeling like you can be successful on the job. And I just wanted to check in with you.
I know. I'm so sorry. You see, my niece who babysits my son got sick this week. My son is only 12, but I had to leave him at home alone so that I didn't have to take time off work and it didn't hit our paycheck more with me staying home to take care of him. I've been pulling my phone out a lot just to check in on him, and the stress of it's keeping me up at night, and I've been sleeping through my alarm. I'm scrambling to just be able to get to work on time and stay focused.
It sounds like you're juggling a lot, and that must be really stressful.
It is, and honestly, I don't really know what to do right now.
Yeah, it's hard to see outside of stressful situations. I can understand that. I'm hearing that there are some situations causing these behaviors, maybe perhaps outside of your control, and I want to try to meet you where you're at and build from there.
I'm trying to find solutions, but you're right, it's hard. I can't control others getting sick, and I can't control that I just don't have enough time in the day.
Yep, that makes sense. What do you think some things are that we can control to help get you back on track?
Just before we go further, am I in trouble?
Katie, when I say I care about your well-being and your success here, I want you to hear that I really do mean that. Maybe we can brainstorm some ways that would support you. It's important that we do take action when we break policies, so we're being fair to everyone. And I understand that keeping life and work separate isn't easy. I think we can find some ways to get back on track, so let's just start there.
Okay, I definitely think there are some things that, I could look into, resources I could find. I would love some more guidance on that.
I appreciate your optimism, I really do. And I want you to know that my door is always open. I may not have all the answers, and sometimes I'm limited in what I can do, but I will listen. Perhaps you're interested in meeting with one of the WorkLife navigators that's a benefit through the employer, and they might be able to help you find some solutions.
That would be great. Thank you.
Cool. So we'll pause there. And I just want to say that last little bit is to demonstrate that as a leader. I know that you might not have benefits like that, but to demonstrate as a leader that you are aware of all the benefits that could support your people, and that you stay on top of those updates and understand those programs so you can make those really good referrals. We always encourage our employer member supervisors to actually test out our service so they know exactly how to explain that experience, because the fear of the unknown is real, and the fear of raising your hand to say, I need help, doesn't always feel good. So there are lots of pieces in that conversation that demonstrate empathy. Asking Katie permission to speak with her, asking her questions, open-ended questions, reflecting on what the employee was actually saying, not saying it's okay when really it isn't. We really need those behaviors to change. Using objective examples and paying attention to tone and your body language. Again, that body language being that 55% of how we communicate. I also try to say why I want to talk to that employee so I don't cause more stress in between the I'm asking you and we're actually coming to my office and speaking.
And we want to stress too, now more than ever, and I think kind of as our last slide shows here, really providing an overview of the things that we at WorkLife do and connecting individuals to resources, is that understanding that asking for help with anything is really, really hard. And now more than ever is the time that we are seeing employees need the most help. And so it's really trying to normalize that conversation as much as possible, that there are those needs. It's okay to have those needs. Maybe even as a manager, supervisor, employer saying, yeah, these are some of the things that even I myself am going through right now. Just again, that normalizing piece is crucial, is huge, and it is absolutely fundamental in leveling the playing field and making everyone feel that they are worthy of getting that support and able to get that support right now. So thank you. Turn it back to David for hopefully some Q&A.
Great. Thanks so much, Katie and Brittany. Really a great conversation about supporting employees and their mental health needs. And I loved some of the questions you sort of posed to yourself, Brittany, during that. I think it's a lot of the internal dialogue that's going on there. People are trying to figure out how they're going to cope, how they're going to make it through this situation. Want to talk first about obviously a really timely subject, which is how you make sure you're reaching hard to reach individuals. So this diversity and inclusivity conversation, we had a couple comments come up about how are we going to ensure that disenfranchised and Black employees are able to take advantage of the benefits that are being offered. I'm just curious, and I do want to mention we are going to have a webinar coming up in July on inequality in the workplace with a presentation on the Black experience and Black employees in the workplace as well. So we know that that is really important and very timely for right now. But more broadly than that, I want to ask about how you can be sure to be inclusive with the resources you're offering. Any tips, Brittany or Katie, of reaching hard to reach populations and ways in which you can get resources to people that don't normally feel like they can take advantage of them?
Right, I can start at least from the employer side of things, and then I'd love to segue it over to you to talk more about the resources specifically. I think, as I talked about not only in the last slide, with really trying to normalize the conversation around, it's okay to ask for help. Everyone within the organization is asking for help because everyone's impacted differently. I think many of our employers have actually started to shift their phrasing of the benefits offerings to, you as an employee have worked so hard and are entitled to every single one of these wellness offerings, whether it's the WorkLife Navigator, whether it's the EAP, whether it's health insurance, whether it's a wellness program, a discount program, a coupon program for things in the community, whatever these programs may be and benefits are, changing the conversation from, well, you have them, so why aren't you accessing them, to you're entitled to these. You've worked so hard to have us offer this to you. And so what can we do to help you access them more readily? How can we make our vendors work on your behalf to make it more understandable, accessible? So really stressing and reframing it in that way has been helpful a bit. But Britt, I know you have more, I think, more tangible ideas on that too, in terms of the connection.
Yeah. Excuse me, sure. It's a really great question. I think something that we could spend a lot of time on. One thing that really comes to mind that has been difficult even for WorkLife is to assess what kinds of access do people have, and trying to be very creative in how we spread this message. Not everybody has a smartphone, not everybody has internet, or we even have folks who don't really use email. They don't really know how to use it. And so just being very open to exploring different ways to share out this information. I think that's something that is within our control, and being willing, something that we've talked a lot about at WorkLife is thinking through what kinds of populations really aren't accessing our resources, and really digging into research behind like the psychology behind why that might be, and trying to bring some more diversity even into our own workforce, to kind of open up that comfort for folks of different races, different languages, to come and access that resources. We've also worked with employers to talk through how do we upskill our own or their own workforce to provide things like translation within their supervisors who say are bilingual. That's been a really cool experience. Yeah, I'm going to stick with those two. I can probably think of many others. So
yeah, well, I appreciate you mentioning that people can access information in different ways. And I think we've shifted recently to just everything being blasted online and virtually via email and newsletter. And that might not be the modality that works for everyone. The other point I wanted to make in there that I heard from you earlier was the importance of middle management and supervisors really understanding the benefits that are offered. And I really appreciate this idea of, as an employee, you're entitled to these benefits. This is part of your overall compensation packet. We want you to know how valuable you are and how valuable these benefits are. But as supervisors, as managers, the more that we can get familiar with those benefits and make sure people can access them, and we're telling them in one-on-one conversations how valuable they as a person are, but also the benefits are, I think is really important too. So thanks for bringing those concepts up. We had another question about maybe a tricky conversation for people, and I don't know if this has come up with employees in the WorkLife network, but specifically saying that I, as an employee, want to let my employer know that maybe we're not having a very supportive workplace right now. And what is a way that I could start to bring that conversation up? Or is there a way that I could bring up a conversation of, I feel like my workplace should be more supportive?
That's a great question. And that is a tough one. I think that is a tough one. And I think it almost is the role reversal of what we did in the mock conversation of a manager supervisor being so aware of wanting to be supportive. I think in those instances, and Britt, feel free to jump on me here. But when I've, spoken with some of our team before, when they've had employees approach them saying, I don't know how to have this conversation because I don't want to come across as complaining, or I don't want to come across as being judgmental, knowing that the employer has their own, pieces they're having to prioritize right now as well. I think it's really being able to hone in on what, not only the message of this is how I feel, but having some tangible ideas of how they would feel more supported. So it's not just a one-way conversation of, I don't feel supported and I expect the employer to come up with ways to help me feel more supported. It's going in saying, and I've thought about it, or I've talked with coworkers and colleagues, and these are maybe 3 ways that we feel like we would be heard or validated more if they were implemented, and can we have conversation around that, knowing that those 3 things may not go into place, but there's at least conversation around them that we can maybe negotiate and see where some of those elements of feeling supported can be integrated into that day-to-day work. I feel like that approaching it again from that stance, as opposed to that judgmental stance, or that why are you or aren't you doing it this way, can get you a lot further. And I feel like an employer, on the flip side, I would hope, would know, my employee would feel more supported or would feel more dedicated or more productive at work if these things were put into play. What do I have to lose in trying to do that at this point? Britt,
Yeah, I'm going to add. Yeah, I do. I want to add to that. One of the books that we really love at WorkLife is called The Four Agreements. And one of the agreements is that we don't make assumptions about each other. And so I think going into that conversation and remembering to have empathy for that supervisor, that leader, is very important. Let's not assume that they know what's right, or that they even know what's going on with you. And to be okay with asking. I think Katie is right. If there's power in numbers, and I think going in and having all of kind of your facts straight and being able to, as best as you can, express what it really is that you are fearful of, and then having examples. I, even more recently, I've had to face this with the employees that I supervise. It's like, oh, this is my problem, but I don't have any solutions. Sometimes for me, I'm like, sweet, I don't know if I do either. Uh-oh, we're in trouble. So helpful tips.
Well, I appreciate you mentioning that, Brittany, too. There's been a number of people that have made comments about the role of supervisors and managers, and how I think we've seen some different narratives about coming across as being a leader in the organization and only putting sort of a positive spin on things. I actually really more like the human and empathy approach, that none of us has necessarily figured this out, recognizing that leaders and middle managers are also under constraints and having mental health issues right now. They're not expected to have all of the answers. So the more we can have a dialogue that feels supportive maybe to the person you're supervising, but also feels supportive to the organization or for your role as a supervisor, the better. So I think that empathy piece and that caring piece, coming to a place where putting well-being first and supporting one another first is really the goal. We had another good question about, and this has come up a little bit, a workplace that has said that return to work is optional, and that's making some employees feel stressed. Like, if it's optional, is it really optional? Am I going to get looked down upon if I don't come back to work? Or what does that mean? I'm just going to stress right here that we've heard that, once again, leadership, the words that come from leaders' mouths and the way that they behave is really important for this particular conversation, because it's sort of like walking the talk here. But I'm just curious if you've had any other thoughts about it's optional and employee stress that comes up about this optional idea.
Mm-hmm. Well, I think one way that you really need to pay attention to is if you really are saying that you can either work from home or you don't need to come into work yet, and those who do, really paying attention to that equity and access to information that's being shared within the organization, and like you're saying, David, really modeling that is okay. I think is one way. Katie, do you have others?
I mean, I guess speaking, from experience, with our team, or just seeing it at work with employers, I feel like some of our employers, if they do have employees who would prefer to stay at home for whatever reason that may be, maybe it's scheduling an additional check-in with a manager that week because they feel, maybe there isn't the need, because you do want that equity of information to be shared, of course. But if there are maybe additional touch points that they can make, if they feel like they're going to be kind of on the periphery of what's going on for those who are actually going in, making that time and sharing that need and explaining why that's so important, because they're dedicated to their work. They want to be showing that they're checking in. I know some of our navigators have worked with employees who have said, I'm worried they're going to worry I'm not working. So it's, coming up with, an email every week or a check-in with a supervisor just saying, hey, these are just 4 bullet points of things I did this week. Want to let you know I'm working on them. These are some things I'm looking at following up with next week. Just finding what maybe that fear is, that underlying fear of why employees feel that they need to go in but they're not comfortable, and seeing if there's other ways around that to help them just feel more comfortable and calm in their situation. And I do think it really does come from leadership down, and making sure that there is that inclusivity, and that everyone feels that they're on the same page, getting the same information, and being given the same amount of attention, and hopefully having that open door policy, if that's not happening, to be able to have that conversation to fix it moving forward.
Well, thank you. Thank you again, Brittany and Katie. We always get more questions than we have time to answer in our Q&A. It was really great to host the two of you. I'm going to have a few wrap-up slides. We don't have time for any more questions today, but just want to thank the care and thought you put into the presentation. We know that this situation has been difficult for people in so many different ways. And now as we're in the next phase of sort of returning to work and reopening of society, sort of new fears and new challenges are coming up, and we want to be able to acknowledge those as well. So a few closing points I want to make. As I mentioned, today marks the 12th town hall meeting that we've had related to COVID over the last 3 months. We've been so thrilled to be able to offer this and to create so many new relationships with people and extend our reach by putting these on. Obviously, we couldn't have predicted that this would be a shift in the work that we're doing. And we've just been, I want to say that I'm grateful for our own team at HealthLinks for putting these together and being able to rapidly respond. The other thing we're doing is we're offering free COVID advising for employers, whether you're in our network or not. These are some of the topics that we have subject matter expertise in our center about that we can help with having a free advising session. These would be virtual consultations at no cost. And if you need additional customized assistance, we can refer you on to one of the experts, the PhDs, doctors on our team for a more in-depth consultation. We can help with health and safety compliance, or how to handle personal protective equipment or PPE, return to work guidelines, total worker health leadership, crisis and risk communications, and this topic that just keeps coming up as so important, which is mental health, social emotional health, and well-being. So we want you to take advantage of this. And the way you can do that is by sending just a general email to our inbox, our open inbox at contact@healthlinkcertified.org. So we'll leave this up for a little while, but you can schedule your free COVID-19 advising session by emailing us. Our follow-up email, as a reminder, will have a recording of the entire webinar presentation today, along with the slide deck that was shared from WorkLife Partnership. Want to remind you also, as you are logging off today, that there is a brief feedback survey that comes up as soon as you leave the meeting. If you could spend just a few minutes giving us your feedback, both for the presenters as well as to inform our webinars moving forward, we'd really appreciate it. It really just takes a few minutes. As we plan on taking this pause from our COVID Town Hall webcast, we will continue to bring you up-to-date information through research-informed webinars in July and moving forward. You will be receiving information soon and in the follow-up email about some upcoming webinars we have going on in July. We have one specifically on inequality in the workplace and the Black employee experience, as well as the integration of workplace health and safety, or achieving total worker health by integrating your health and safety programs, which is really the core message that we talk about with employers, that health and safety are connected. Our webinar series continues through the fall, and we look forward to helping you achieve total worker health. Thank you again to our presenters, Brittany and Katie from WorkLife Partnership, and for all of you that joined us today. You can find us on social media through Facebook, Twitter, and LinkedIn. And please don't forget to complete the feedback survey. It's been our honor to host these town hall meetings. Again, big thank you to those who have participated, and to the entire HealthLinks team that has just done such a great job putting these all on. So thank you.
Thank you so much.
Thank you.